This meeting is being
Sure.
recorded.
People can hear me well. I'm Robert Dempsey, and we're doing our neurosurgery department COVID-19 update at this time. The past couple of weeks, we've taken up the grand rounds for very formal lectures on this topic. And I wanted to move to this less formal setting as we're getting into more of a steady state of our treatment of COVID. And build upon those lectures as to an update of where we are now and where we hope to be in the near future. This should make sense if it builds on the other two lectures, but also should allow us to have some time. So we spend 10 or 15 minutes on an update and then look for questions and call in. The idea is to allow us to resume our academic programs during grand rounds and also to allow more user-friendly time in the afternoon on Wednesday for us to do the updates. The first thing I'd like to mention is that this is a major crisis, but I'm very optimistic. We are handling it remarkably well compared to what could have been if we had not taken steps. And I think the ideal place, just as predicted, was Madison, Wisconsin, because of a very cooperative population and a very well prepared major hospital system of hospitals, I should say. But the university hospital, with its inventiveness, its techniques, its testing, has been important. It has been extremely impactful. I want to point out that we've reached the 2 million point now on known cases worldwide, with 129,000 deaths. I also want to point out that that's far less than could have been if measures were not taken. Because remember, there's no real treatment. There's no vaccine yet. It's mostly setting up conditions that the virus cannot spread easily by self-isolation, by identifying contacts, by identifying cases and isolating them quickly. You can see where testing is so important. While testing coming late to it has been an issue, we've still, with isolation, done well. The US is at 600,000 cases, 26,000 deaths, far less than could have been. I predicted that these isolation strategies would cut the death toll by 2/3. I think that's about what's going to happen. The 2 million mark worldwide is important. It tells you that this was far more infectious than SARS and MERS, which reached about 1 million worldwide. And the combination, when you look in Dane County in Wisconsin, 3,500 cases in Wisconsin, 170 deaths, 344 cases in Dane County, only 12 deaths. The proportions really suggest that areas that took these steps were very successful. And I think it's important to put it in context. We've just finished the flu season. Flu is very, very infectious and because it is less lethal, has really not received this attention. In spite of this isolation, which took place at the end of the flu season, there were 39 million flu cases in the United States this year. Yet because it is approximately 20-fold less lethal than the COVID-19, its impact was really, all the emphasis was placed on the COVID-19, and I think appropriately. If you look at our own local situation, it's important to know that the university hospital is not overwhelmed by this problem. We're doing very well. We are being able to identify and isolate cases appropriately. We have PPE by carefully conserving it. We have enough. We have ventilators to spare, and we have kept it quite low. Indeed, if you look at what's going on, our cases are such that they are, this is worldwide, beginning to see a leveling off. That would be to say that as opposed to a surge, which we all feared, we saw a slow rise, which really over the last 4 days seems to have plateaued. If that's true, that means that the virus is having difficulty finding new cases. This disease probably, with the average infected person, was infecting 4 people when it was rising. If it begins to infect less than 1, it will die off gradually. But that die-off of the virus is going to take probably as many months as it took to climb. So it's very important to maintain this vigilance and maintain that. And that's rather important. There are several things that we've learned about this. And one is that we can keep people safe in the university hospital. Our patients that have had the urgent and emergent surgeries have come in, have done well, have gone home. And that will continue. It is quite likely that the lessons learned will be very useful as we begin to return toward normal, or what I hope is the spring and summer. One of the most important lessons that we've learned is the importance of telemedicine, which by that I include phone calls, video, electronic meetings. Because of the embracing of this by CMS, we're beginning to learn and use it nationwide, worldwide. And I truly believe that it's so important that the investments that are being made in telemedicine now, even though they're not fully rolled out, will be continued in our standard of practice, which we'll be able to screen people, we'll be able to look at their wound or their rashes, etc. We'll be able to give them very quality care in a more efficient way. And that's one of the things that will come out of this, just as learning how to modify ventilators, learning how to preserve PPE, learning how to be prepared for any infection. It became very obvious today when we had a tuberculosis patient who was very smoothly able to care for that age-old disease using the techniques that we had modified for this very new or novel disease. So major changes will come, which will help speed our re-emergence, and that is going to be based on rapid testing and less so, unfortunately, on antibodies. As we can do the logic of rapid testing, we can identify when a patient comes to the emergency room, needs emergency surgery, are they infected or not? Do they need to be treated on the infected or COVID side of the hospital or the clean side? Can we work with much more safety for our staff? Because we can, and because those tests are becoming more and more available at this level, we'll be able to identify improved care. The testing problem within this population remains, and that's difficult because it causes us to underestimate the number of cases. And if you begin to look at how epidemiologies look back on these pandemics, they often understand that we underestimated the number of cases. A good example would be New York, where there has been a large outbreak or surge of COVID. But what happened in New York was that people began to look just recently at what is the average death rate in New York City in March, and what was the death rate this March. We can see that that's a massive increase, maybe 30,000. But they only noticed 15,000 with COVID, suggesting that missed people at nursing homes or dying with other complications may have been due to this disease. That's the difficulty with not having really good testing. The better we improve that, the better we isolate contacts, the better we're able to put an end to this epidemic. The logic of antibody testing is interesting, but right now, to be honest with you, the antibody tests are so variable in ability, and all they tell you is that you had the disease. I think they'll be important as we look back on it, but it's going to be very hard to use antibody testing to use a strategy of how do we go forward or when do we reopen hospital beds or society. I think that's going to be based on new cases identified, death rates going down, and the ability to safely care for people in the hospital. The hope for a vaccine remains. That is the way you end this completely. The only other ways are changes in the viruses, which did happen with SARS, or some sort of environmental clues which cause it to die out. Unfortunately, this does not seem to be temperature dependent. We are through with our flu season, but not with a COVID-19 season. That's not surprising when you remember that this is a virus that is similar to the MERS, which started in the Mediterranean or the Mideast. So this one is seen worldwide. However, I do believe still that the vaccine, the way that it's being rolled out and the way that they're being tested, already starting some human tests, that we will be able to be ready to avoid a second surge, which could come later in the year. That's my hope, but I think that's really important. The next major topic is the reintroduction process. When we become more confident that what we're seeing as a plateau is actually becomes a decrease in cases, when can we rejoin our society? And we're learning that it'll become by an iterative process, step by step. The first thought is, of course, the hospital. If the hospital can safely care for people and has adequate PPE, the hospital may be able to open to take care of less emergent, still urgent cases sooner. That's my sincere hope. As we begin to understand that we may need less of our ventilators to be held in check for COVID patients, we may be able to move on to more operations. And then the next question is, we must continue our work. Everything we do is important. The academics, the work on stroke, the work on tumors must continue. And that's where everybody is so important, where it's important that we continue our work. So in summary, we're doing fine. This is a very dangerous disease, but the steps that have been taken have done a great deal to limit it. And yes, we can see a light at the end of the tunnel. It's not quite clear how long that will be, but we're beginning to think about a process about how we carefully reintroduce our work and our workspace in a safe fashion. Those plans are ongoing, and that's a very optimistic sign, so that I want people to know that what they do is important. What they've done so far has been essential. And what the people working at home does is an essential part of that. Remember that at all times. So that's my major summary. It's an optimistic one. It's a brief update. And I hope we'll do this weekly and allow us to have time to answer your questions, which could come by chat or by speaking up. So Stevie, do we have chat questions?
Nothing has come in yet.
Okay. And people may unmute themselves if they'd like to ask a question as well. So I'm going to just summarize that, please reassure the people you care about. Look after the people like your families, your elders, the elderly neighbor, that things are going as well as could be for a very difficult disease, probably 20 times more deadly than flu, but well controlled, and we're putting an end to surges. If we can continue that, we will save many, many lives. Everybody's efforts has been valuable. Preparations here are quite good. All the work you do from home is as important. Stevie, if we have no other questions, I'll sign off then. Okay.
Yep, sounds good. No questions.
We will send a link to, if you wish to share this with anyone, and an outline of what we talked about. Thanks very much.
Thank you.